The Empower study shows that another agent that targets PD-1 beats chemotherapy in the frontline setting of lung cancer. Cemiplimab, already approved in cutaneous skin cell tumors, versus chemotherapy, hazard ratio in the high 0.5 range. It's another drug that we'll probably have available. This trial is a little bit unusual. Why? Well, one thing, they required everyone to smoke. So they wanted to sort of enhance the chance that they'd see a benefit. It was a real-world trial. It was done completely outside the U.S. The presenter was from Turkey. It's good to see that these trials are being done, and other places. Of course, the reason for that was it was being done at a time when there were already other agents like pembrolizumab, approved in much of the Western world. But that said, the trial was positive. It allowed patients with brain mets, and if you looked at the forest plot for patients with brain mets, there was a survival benefit. I think that's a good advance for the field. They had some issues with their PD-L1 testing. That tells you what happens in the real world. They had a couple hundred patients that needed to have their PD-L1 retested. So they showed two populations, an entire population and a PD-L1 50% or more population. Both groups were positive. Be nice to know a little bit about what happened with the PD-L1 testing. Makes you think, maybe in the old checkmate trial of nivolumab versus chemotherapy, maybe they had similar issues. This PD-L1 testing is not something to take for granted, and there are already so many variables in how you measure it that the assay technique can have an effect. But no matter what, I thought the trial was a positive trial. They had some patients who got chemotherapy with the PD-1 inhibitor on recurrence. They didn't really have enough in the trial or show us much data as to what difference that made. But it makes me think about the Insignia trial, which is being done here in the United States through the cooperative groups, the ECOG and the SWOG, Hassan Borgai and Ann Cheng being the PIs, where we're looking at pembrolizumab versus pembrolizumab plus chemotherapy to try to answer the question of, what to do frontline. Should you use chemoimmunotherapy or immunotherapy alone? But also on recurrence, what does it mean to add chemotherapy to immunotherapy? So a lot of interesting ideas there, and I applaud it as a positive trial. And just add another agent. We already have pembrolizumab and atezolizumab. Those data, of course, presented by myself at the ESMO meeting in Geneva just last December. They'll be out in publication pretty soon. Certainly, this gives us more agents to work with and more agents to combine with, because the next step here are going to be those combinations that we're all looking forward to.